Hello guys, today I will be talking about diabetes. Please listen to this video to the end as you would learn a lot from this video and you could save yourself or your loved ones. I know a lot of people have heard about diabetes, but they might have little knowledge about it. In this video, I will be talking about what diabetes is, types of diabetes, symptoms of diabetes, which is when you need to see a doctor, causes of diabetes, living with diabetes, diabetic eye screening, and diabetic foot problems. So let's talk about diabetes. Diabetes is a condition that causes a person's blood sugar level to become high. There are two main types of diabetes. We have the type 1 diabetes and the type 2 diabetes. Type 1 is a lifelong condition where the body's immune system attacks and destroys the cell that produce insulin. So insulin is a hormone that regulates the amount of glucose in the blood. Glucose is also a type of sugar. So the lack of insulin causes a form of diabetes. Then let's talk about type 2. Type 2 diabetes is where the body does not produce enough insulin or the body's cells do not react to insulin properly. Remember, we talked about what insulin is earlier. Type 2 diabetes is far more common than type 1. We also have situations where blood sugar develops during pregnancy. It is known as gestational diabetes. It usually goes away after giving birth, so you don't have to worry too much about it, but it could be a risk factor. There is also a non-diabetic hyperglycemia, which is also known as pre-diabetes. People in this category have blood sugar levels above the normal range, but not high enough to be diagnosed as having diabetes. So this is known as non-diabetic hyperglycemia or pre-diabetes, like we said earlier. People with non-diabetic hyperglycemia are at greater risk of developing type 2 diabetes, but the risk can be reduced through lifestyle changes. If you have hyperglycemia, you may be able to reverse it with lifestyle changes. People that have non-diabetic hyperglycemia are recommended to have blood tests every year to monitor their blood sugar levels, or if they notice any symptoms that they are not sure of. It is very important for diabetes to be diagnosed as early as possible because it's likely to get worse if it's left untreated and can cause a long-term health problems such as stroke, heart attack, problems with kidneys, feet, eyes, nerves, and others. So here are some lifestyle that can help to prevent the pre-diabetes from getting worse. So basically, if you already be diagnosed with pre-diabetes, for you to prevent it from getting worse, there are some lifestyle you can improve or change. So number 1 is physical exercise. Try at least 30 minutes of raising your heart rate 5 times a week. This can be broken up over the course of the day. Example is you do it like 15 minutes jogs 2 times instead of just going 30 minutes. You can repeat that for like 5 times in a week. That way you've achieved at least 30 minutes of raising your heart rate 5 times a week. Number 2 is losing weight. If you're overweight, you have to try to lose weight. Number 3 is dietary changes. You should eat more fiber and less fat. Number 4, cut down on processed food. Examples are shop-bought ready-made foods. You know those already made food already just to microwave and eat. Cut down on them. Those are processed food. And also drinks, processed drinks. Number 5, reduce the amount of sugar that you eat and drink. For example, cakes, biscuits, soda, high sugar drinks such as mineral and beer. Some people didn't know that beer has sugar, but beer is a sugary drink and it has caused a lot of people to have diabetes, and it's really something that can be prevented. Number 6, cut back on snacking between meals. Number 7, eat real food as nature intended, including protein such as meat, poultry, eggs, and others. Number 8, reduce starchy food such as bread, cereals, and potatoes. These lifestyle changes, if you put them in practice and you have pre-diabetes, you might be able to prevent having diabetes. So let's talk about the symptoms and when you need to see a doctor. Like I said earlier, it is very important for diabetes to be diagnosed as early as possible because it's likely to get worse if left untreated, and this can cause long-term health problems. So what are the symptoms of diabetes? The main symptoms of diabetes are 1, feeling very tasty. When you are always feeling tasty, you know you're drinking but feeling tasty, your mouth is always dry. That's a warning sign. Number 2, if you feel like peeing frequently, like weighing, urinating more frequently than usual, particularly at night, my dear, is a red flag. Number 3, if you feel very tired, that fatigue, exhausted feeling without any tangible reason why you're tired, that's also a red flag. Number 4, if you're experiencing weight loss and loss of muscle bulk, that's when you're losing weight and you're eating your normal balanced diet and you are not starving, but yet you are losing weight. That's a red flag, my dear. Number 5, blurred vision. So when all of a sudden you start having blurred vision, know that there is something wrong. You need to see your doctor. Number 6, if you're having itchiness around your penis or your vagina or frequent episode of thrush, that's a red flag. For those who don't know what thrush is, this is a common yeast infection that affects men and women. It's usually harmless, but it can be very uncomfortable and it keeps coming back. It is not classed as a sexually transmitted infection. The symptoms of thrush in women are white vaginal discharge. It often looks like cottage shears, which does not usually smell. It causes itchy and irritation around the vulva and the vagina, soreness and stinging in the recess or when you pee. And the thrush symptoms in men include irritation, burning and redness around the head of the penis and under the foreskin, a white discharge like cottage shears, and a pleasant smell, difficulty pulling back the foreskin. So these are some of the symptoms. We can elaborate on this in another video. So regarding diabetes, the symptoms I've mentioned are the symptoms you need to watch out for. They are red flags. Okay guys, I will be ending the video here because if I continue the video will be too long. This is the part 1, but I will be posting the part 2 immediately that talk about the other topics. So in the part 2, we'll be talking about causes of diabetes, living with diabetes, diabetic eye screening, and diabetic foot problems. So make sure you watch the part 2 because I'm posting it immediately. They are all one video, but it will be too long if I continue. So I'll be posting it immediately. Please, as soon as you finish watching to this point, go watch the part 2. Thank you very much, and I hope this gets to someone that needs to hear it. Thank you.